Hi, this is Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this series, this trauma and healing series brought to you by Blue Shield of California's Blue Sky Initiative. Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. About 15 million adults experience post traumatic stress disorder or PTSD during a given year. And that's only a small percentage of the 223 million people who experience some type of trauma at least once over the course of their lives. We've known for a while now that trauma can have a profound, lasting impact on our mental health. Today, in one of a series of Brother Be Well conversations on trauma and healing, sponsored by Blue Shield of California's Blue Sky Initiative, we're speaking with marriage and family therapist and Brother Be Well clinical advisor, Christian Jacobs, about the mental health impacts of trauma. Christian, how's it going? Welcome back to Brother Be Well.
Hello, thanks for having me back once again, Michael. Good to see you.
It's great to see you. I love how you and I can smile even when we're talking about a pretty serious topic. You know what I mean, Christian? It's great to see you, but we got some heavy stuff to talk about.
Most definitely.
Let's get right at it if you don't mind. For those who may not have checked out our very first What is Trauma video, please give us a brief overview of trauma.
Sure. Well, from the last video we talked about, we really covered, some of those impacts and, of trauma and how it looks, and really some a little overview just to really talk about the four types of trauma, just to get people caught up, which is the fight, flight, freeze, or fawn mode that we go into automatically in our brains when we hit some type of physical or mental or emotional trauma. And I gave some examples previously of that. Fawning is really someone who really goes into a mode of looking at the abuser or the aggressor, looking to help them out versus helping themselves. That's a fawn. Most individuals aren't familiar with the word fawning, and of course, freeze is just when they experience that trauma, that traumatic feeling. It's a freeze mode. They don't move. They kind of stand still, and emotionally they're frozen. And then the fight is basically what it sounds like. They once they experience that trauma, they fight back and they respond in a fighting mode. And of course, the flight is just running away. And, we also did talk a little bit about the biological aspects of that too, right? So you're looking at the chemical impacts of that serotonin that goes in your body, that the lack of serotonin actually that occurs that makes your body feel good. And you're looking at that stress hormone, the cortisol that's being released, which can cause, several health implications that we talked about. Having that chemical release in your body constantly over time can have several health issues such as high blood pressure, weight gain, and hypertension. We also did talk about acute trauma too. So we talked about acute trauma and looking how acute trauma results from a single incident, and then we got into the chronic trauma. How you're looking more of a in-depth trauma where it's ongoing, where the trauma is not resolved, where it may go away and then you have repeated or prolonged issues such as like domestic violence is a really good example of how that trauma continues on. Then you have the violence and abuse, complex trauma. We talked about that as well. We have the multiple, the varied traumatic incidents that could be very invasive and impersonal in nature. And then for ourselves, I use the analogy of of seeing our bodies, as a high performance car and how to identify those. So those just a quick overview of the things we talked about in our last podcast, and just to give everyone a good overview of what trauma is.
You've done an amazing job there, Christian. I could imagine you in a classroom setting. That was a heck of a summary of that first thought. Really appreciate it. And some of those topics we're going to drill down deep a little bit more today. And in another production, we're going to talk about the physical impacts of trauma as well. Can you walk our viewers and listeners through the problems that exposure to trauma can cause us during our mental health journeys?
Yeah, this is a really complex topic, and I think the the best way to start this out is really talking about how the trauma in itself is a mental health issue. So when you're looking at mental health and trauma, they go hand in hand. So when a person deals with trauma, right, related to diagnosis such as some of the stressors, right? So the DSM, the Diagnostic Statistical Manual, the book that's used, the clinicians use, any mental health professional uses to diagnose a patient or a client with a disorder. There's different categories, and PTSD falls into that the stressor categories. So you have PTSD in that category is PTSD adjustment disorder, which is basically someone who good example for adjustment. Um, Basically, if someone goes to school, in a new neighborhood and they've lived in a certain neighborhood for a long time, and now they're going to a new school, you know, um, they can be experiencing adjustment disorder, but those symptoms look very similar to PTSD, right? So there's a differential there that we'll talk about. Reactive attachment disorder is a disorder as well that's really connected to the stressors. These are children's diagnosis, by the way. Disinhibited social engagement, which is exactly what it sounds like, where a child is disengaged. Reactive attachment is when a child is too engaged too much in the individual. They violate an individual's personal space a lot. You see this a lot within children in foster care. They have no boundaries basically because they've been shuffled around so often that those inhibitions have kind of gone away. Those boundary issues. So you see that these are all stressor diagnoses that they're in the same category in the DSM as like a PTSD or acute stress disorder, and also the trauma stress related. And there's other issues such as anxiety and depression, right? So you may have someone experiencing the diagnosis I just kind of explained, and then they may have an anxiety and depression. So now we're talking about a dual diagnosis, and that's exactly what it is. It's a it's two diagnoses. So you're looking at someone who may have a trauma or stressor related diagnosis, such as PTSD, and a mood disorder, such as depression. So the hard part is you have to meet the criteria for all these, right? So trauma can really skew those pre-existing mental health conditions, and one may really have experience too prior to experiencing the trauma. So as a clinician, you got to look and see, okay, which one came first, right? Was the cart or the horse? And the challenge is also being able to differentiate and those symptoms associated with the individual conditions too. So disorders really do how it really depends on how trauma impacts the central nervous system and the body overall. So, for example, if you already experience anxiety, right, where someone may experience nervousness and worry, for example, and then they were recently diagnosed with a traumatic disorder, such as the ones I named earlier, right, which causes paranoia, hypervigilance, one must work really close with their therapist to really decipher, how to treat both when they have very similar symptoms. So the primary issue really is being able to treat and address all or both of the mental health conditions at the same time, and that's the daily task that mental health clinicians deal with on a day-to-day basis with patients.
Really appreciate, Kristen, you giving us so much information and so much context for what we're talking about. We've got this whole series that we're doing here on the Brother Be Well platform. We could talk for quite a long time about any one of a number of these issues, I think. Could you please summarize for us how trauma can really impact mental development of our young people? I understand that a severe traumatic event can really stall the development of our children, mentally and emotionally. And we certainly don't want to do that. Could you walk us through that just really briefly?
Sure. This is such a good topic because, Michael, because I think many people are really unaware of the connection between trauma and how it could stifle and impact one's overall development, right? The childhood, not just development, but you have the childhood development, early childhood development, and cognitive development all happening at the same time. And remembering, that, an individual's brain, more specifically women, for example, their brain is still developing up all the way through their 20s. So, early 20s. So you look at brain development is in addition to trauma, and you mix those up, and a lot of things can happen. And so, just in terms of a child's brain, when trauma really occurs, it's the neurological development that's happening. So the brain becomes distorted, such as those survival mechanisms that we talked about right earlier of the brain, and body are more dominant in the learning mechanism. So instead of that brain learning how to learn, their brain is more focused on survival. So as those stages go along, those the 0 to 6, 0 to 5, those ages, instead of them learning, their brain is focused on survival. So all this impacts their ability to memorize, for example, the memory. We talked about that, and it impacts their ability to learn social norms with peers and family. And so complex trauma for a toddler, for example, or adolescent in relation to traumatic experiences, it impacts the brain where it disrupts the child's stress, those stress hormones, so the cortisol, so which leads to chronic hyperarousal and ongoing sensitivity to stress. So you have that issue going on too in the brain. So now this child's brain is releasing cortisol, at different rates where it should not be releasing cortisol. So in other words, it makes them become more hypervigilant and on edge because it's focusing on that hyperarousal. Studies also show that children exposed to neglect also maybe more vulnerable too to general delays in language development. So a lot of studies have gone to that too. So you're looking at the impacts of language, and so the points I made really sum up why some adults who've experienced childhood trauma may behave immaturely and possess the emotional development of a 6 to 8th grader. And I'm going to touch on something here that a lot of people can relate to because you may see it on some of the some shows and things like that where they really focus on these documentaries on individuals who've been locked up or inmates or incarcerated, things of that sort, or sex workers, for example. Sexually abused individuals may experience this emotional immaturity. So you may see some of these individuals who are older, they may be in their 40s, 50s, 60s, but their level of maturity is of a fifth grader or a fourth grader, or even someone who's 10 years old. That's the result of getting stuck in a stage of emotional developmental stage when the trauma occurred. So I know we talked about blocking in the past. So for example, if a child experienced trauma at the age of 10 and that trauma occurred, what's going to happen is automatically your brain is going to do some blocking, where it's going to block your emotional state at that time, and at times it keeps that individual where they are. So they did not progress, and they did not grow emotionally, and they didn't mature in the right context due to that blocking. Your brain basically trying to protect you. And so as they move on throughout life, they may feel afraid to continue, to like take those emotional risks to develop that subconsciously. So that's just one way that, that maturity and that trauma can, go hand in hand, how it can be really impacted.
I learned so much from these conversations, Christian. I know so many of our viewers and listeners are going to as well. I wasn't aware that I love the way you put it. I'm going to paraphrase. You said that development kind of stops wherever that person is at. So if that adverse childhood experience shows up when they're 8 or 9, in some ways they may be stuck right there in terms of emotional and mental development. Is that a pretty accurate
Absolutely.
summation? Wow, it's
And
amazing.
it's not contingent for every patient who experienced trauma. Everyone's
Yeah.
different. Some of them it may be more subconscious. It may be it happens at a later stage of life, or it may not be as extreme. But studies do show that that does happen in individuals who have untreated trauma for long periods of time.
Wow. Wow. Well, all the more reason for us to get at some of these issues and some of these topics, no matter how difficult they might be for some people. Really appreciate you, Christian, and appreciate you for listening in and watching this video. talk about some of the other impacts of trauma. We've talked about some of those impacts, Christian. Just during a little research of mine, exhaustion can show up, confusion, sadness, agitation. Can you talk about some of the ways in which untreated trauma can show up in your body, so that we can begin to either see it in ourselves or maybe see it in one of our loved ones, and maybe begin to question whether or not there's something going on sort of behind the scenes there?
Yeah, Michael, there's a lot of physiological and physical traits that can show up due to untreated trauma. And for example, it can really blur the lines in terms of, again, what came first, the cart or the horse. So when someone goes to the doctor's office, right, they're having here's one example. They may be experiencing fatigue or muscle soreness, or their muscles are trembling, or they can't focus, or they have that isolation issues. Or for men, there may be erectile dysfunction issues. So they don't know where this issue is coming from. So these are some of the physical things that can happen. And emotionally and mentally, depression is another common feature that could occur, when an individual is experiencing trauma. And, behaviorally, you have the violence towards others. So sometimes individuals may be acting out with their amongst their peers or their partner in a violent manner. They may be more on edge. So there's some biological and physical, emotional things that could show up. And as you said earlier, the disengagement. Someone's isolating themselves. It's another behavioral factor. So that's why there's a biopsychosocial that's done with patients. You're looking at the biological factor, the psychological factor, and the social factor of how it impacts an individual wholly, so you can really get a good implication and a prognosis on how to treat a patient. So that's why you do that. Also, some of the emotional things is, as we talked about before, smells. You're being really particular to smells, and also substance abuse issues too. That's really another common characteristic in terms of individual who may be resorting, leaning on the substance abuse, whether that's alcoholism, things of that sort. So those are some of the things that can jump out at you when you're wondering, what are some of those reactions to trauma, and what are some of the common things that may occur.